Assalamu alaikum. The long clinical day. First scenario, Mrs. Mona, 35 years old, presented with recurrent blackout. Please take history, examine her, and address her concerns. Are you ready, Dr. Mahi?
Yes, sir. Yes.
Okay, here you go.
Hello, good morning. I'm Dr. Ismail, Senior House Officer on duty now. Am I talking to Mrs. Mona and you are 25 years old?
Yes, doctor.
Welcome, Mrs. Mona.
Yeah, welcome, doctor. Thank you.
Today we will discuss your health issue and I will examine you and address your concern. Is that okay with you?
Yes, doctor, please.
What brought you to the hospital today, Mrs. Mona?
Yes, doctor. Actually, I'm noticed I have this recurrent blackout, doctor, since months back.
1 month back.
Yeah, 1 month back. This has happened to me, doctor, 3 times. 2 or 3 times happened to me, doctor.
Hmm. I'm sorry for that, Mrs. Mona. Um, Can you describe for me this episodes, how it happened, gradual or sudden? Or
Yeah, doctor. Actually, lose of my consciousness, doctor.
can you explain me? Sorry, what are you doing during this attacks? You was running, you was ads, see, watching television. What are you doing at that time?
No, doctor. Actually, this has happened to me. Actually, I'm working in factory. Okay. Uh, you know, my factory, my nature in work, we need to stand for a long time like this. And actually, specifically that day time, I think I received phone from my family. I lost one of my family.
I'm sorry for what you lost from your family, Mrs. Mona. But until now, I wanted to know more details. Every these 3 episodes, the first episode, can you tell me the situation? What
Same.
what you were doing at that time before immediately you lose your conscious?
Yes, doctor. Actually, I'm doing, I'm working hardly. I, like long standing,
كلها
I'm
خلاص.
working.
Hmm. Long standing. At that time, you fall down.
Yes.
Any witness see you while you fall down?
Uh, uh, I'm not sure, doctor. Yeah, there is a
What?
surrounding to me
Yes, what he told me. For how long you lose your conscious living?
for few seconds, just doctor.
Mm. And how you recover spontaneously or by
Yeah,
sugar
yeah,
or glucose?
exactly, doctor. Spontaneously, I recover.
So after you recover, do you feel any headache,
No, doctor.
any change in your conscious level?
No, doctor.
Any did you bite your tongue?
No, no, doctor.
Any trauma to the head or any limb?
No, doctor.
Sorry to ask you, Mrs. Mona, anyone check your blood sugar during or after this episode?
Yes, doctor. Actually, my blood sugar was taking during time. I think was found normal, doctor.
Normal. Okay. Um, the 3 attacks are the same. Same. You are was in the factory and you was standing for a long time.
Yes, doctor.
Okay. I'm sorry to ask you this sensitive question. Did you wet yourself after you lose this conscious level?
No, doctor.
Anyone told you that your face color changed to blue to red like this?
Uh, yes, I think my face become pale.
Mm, okay. Mrs. Mona, do you have any past medical history I should be aware of?
No, doctor.
Uh, what about your health in the past? Any change in your weight?
No, doctor.
Any,
Actually, I'm fit. I'm fit woman, doctor.
any change in your bowel habit?
No, doctor.
Any change in your water work?
No, my water fork is fine, doctor.
Do you have any skin rash?
No, doctor.
Any rash on sun exposure?
No.
Any change in the color of your skin?
No, doctor.
Do you you are tolerant to cold weather or hot weather? Any changes?
No, doctor.
Okay. Do you feel any pins and needles in your hands or your legs?
I didn't notice anything.
Mm. Okay, Mrs. Mona. Okay, Mrs. Mona. May I ask you, Miss Mona, do you have any headache?
No, doctor.
Any shaking of your body?
Actually, during this attack, I noticed my limb is jerking. Just
Mm.
there is one told me like this.
One limb only?
Yeah, both limb I think is jerking. Just
Okay. In the three attacks or only one attack?
I'm not sure what is the last one.
Mm. Okay. Do you have any heart disease before?
No, doctor.
Do you have
Actually,
any
no.
shortness of breathing?
No,
Any chest pain?
no, doctor.
Any noisy chest?
I didn't notice, doctor.
Mm. Any difficulty swallowing?
No,
Okay. Do you have any joint pain?
no, doctor.
Okay, Mrs. Mona. May I ask you, Mrs. Mona, do you have any family history, any disease runs in families?
I think, doctor, yes, my uncle he passed suddenly when he was 65 years old.
65?
Yes,
Sudden, he passed away sudden?
yeah.
I'm sorry for your uncle. But any explanation for this sudden
No,
death?
no, doctor, no.
Okay. But what about your father, your mother? They are okay?
My father, my mother is okay, doctor.
Okay. Okay. Do you have any medication list, Mrs. Mona?
Uh, just sometime I have a headache. I took paracetamol.
Can you give me more details about this headache?
No, doctor. This headache, I think after working, it is not concerning now, but this is
Mm.
my only medication I took.
Okay. Apart from this painkiller and over-the-counter medication, do you have any other medications?
No, doctor.
Do you use your steroid medication before?
No,
Mhm. I'm sorry to ask you this question. Uh, this sensitive question. Do you have any recreational drugs?
no, doctor.
Okay. Mrs. Moon, I wanted to ask you some private questions, if you don't mind.
Okay, doctor.
What about your period? Is it regular?
Yeah, my period is regular, doctor.
What about the amount?
Normal amount.
Mm. Any was a chance of pregnancy either before or now?
No, doctor. Actually, I'm single one.
Any miscarriage before?
No,
Do you use birth control pills?
no, doctor.
Okay. Mrs. Mona, may I ask you, what do you do for the living? You told me you are working in factory.
Yes, I'm working in factory.
What's this factory? What it is doing? What factory for what?
Uh, like yogurt factory.
Yogurt,
Yes,
milk, and dairy.
yes,
Dairy.
yes,
Okay,
yes,
okay,
yes.
okay. Do you smoke?
No, doctor.
Hmm. Do you drink alcohol?
No.
Okay. How much is this problem of loss of your conscious level affect your daily activity and your job?
Yes, doctor. I'm thinking too much. What's this problem I have? I have
Mm.
cardiac disease. I don't know, doctor.
Mm. I'm sorry for that, Mrs. Mona. I will give you sick leave until we fix this problem. Do you drive?
Yes, doctor, I do.
Okay, I advise you to stop driving meanwhile and inform DVL until we know what is the cause going on and fix it. Okay?
Thank you, doctor.
May I examine you?
Yes, doctor, please.
Okay, I will examine the hand, any abnormality in the hand, any pallor,
Just
any clubbing, and
tell me,
illumination.
tell me. I will tell you.
I tell you, any pulmonary edema,
No, any pulmonary edema.
any tremors,
No,
Any clubbing?
no,
Any leukonukia?
no.
What about the pulse?
Yes, pulse is 80 beat per minute regular.
Equal in both sides.
Yes.
What about the blood pressure?
Blood pressure 120 over 80.
I wanted to examine it supine understanding. Is there any difference?
No, it's okay.
No difference?
Yeah, no difference.
Any proximal myopathy?
No.
Okay, I will see the face. Any rash in the face?
What you examine? No, no rash.
No rash. What about pallor? Is there any pallor? Signs of pallor?
No balar.
Anyone told you you have a pale other than before, Mrs. Mona?
No, doctor.
And no pallor, no jaundice?
Yes.
I wanted to examine the mouth for any change in the color of the mucous membrane, any purpura, any hygiene, any abnormality.
Mouse examination is normal, doctor.
Okay, I want to see the neck for any swelling of the neck,
No,
goiter,
no,
any race of GVB,
no,
any lumps or bumps, lymph nodes.
no, doctor.
Do you have any rise of your body temperature, Mrs. Mona?
No, doctor.
Before
Yeah.
I will see the heart auscultation, any murmur.
Uh, no.
Apex is in fifth intercostal space, mid-clavicular line.
Yes, apex infused the cost of the clavicular line.
Clear chest,
Chest examination is clear.
abdomen, no organomegaly.
Yes.
Okay. May I see the power on the lower limb?
Power in the lower limb,
Mm.
what you
Power.
normal, normal.
Okay. 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 So, Mrs. Mona, I wanted to discuss with you for this jerking of the one limb. It is recurrent
Yeah.
in in the three times of episodes. It happens three times.
I'm not sure, doctor, but I notice this is the last one. I tell you,
Mm.
this is like jerking, yes, movement, my limbs, not like tonic colonic.
Mm. It is tonic colonic jerking.
No, 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 just like limb jerking.
Well, okay, okay. And you don't have any family history uh, of EB of similar condition. You don't have any
No,
similar. Huh?
no, doctor.
Mm. Okay, okay, Mrs. Mona. What is your concern, Mrs. Mona?
Yeah, doctor. What I'm afraid this is my be cardiac issue, doctor. What's this blackout I have, doctor? Please help me.
Why you are concerned for about the heart? There is no family history of sudden death in the family.
I'm not sure, doctor.
Eh, You have
2 minutes left.
you have siblings, huh? You have brothers, sisters.
Yes,
Anyone,
both are okay.
anyone, anyone have similar condition for this?
No, doctor.
Hmm. Okay, Mrs. Mona. I appreciate your concern, Mrs. Mona, and I wanted to tell you, heart problem is still one of the possibility, but I will do for you is a heart tracing to exclude or rule out heart issue for this issue. But it looks for me from the first that it is a simple fainting. And your uncle who passed away at the age of 65 less likely to be of يعني similar to your condition. I also thinking about increased electricity of the brain. So I will consult a group of doctors, including the brain doctor, for because this is jerky movement as you told. So we will do for you brain tracing also as well. Okay.
Thank you, doctor. Yes, doctor, it is treatable. Is this my condition will come again, doctor?
Possibly it will come again as long as we did not know the diagnosis and fix it. At meanwhile, it is early for me to answer this concern, it is treatable or not, because we until now don't know it is related to the heart or related to the brain, or it is simple fainting. So I will run for you some tests, including a test name as table test. And after the result of these investigations, I will update you. At the moment, I want you to stop driving because now it is dangerous for you and others. Okay?
Thank you, doctor.
Okay. Okay.
Okay, Dr. Muhi, summarize the case, please.
This 25 years old female patient, she is healthy, working in factory. She's standing for long time. Three times she lost her conscious level for few seconds and spontaneously recover. And there is no evidence of hypoglycemia.
Yes,
Uh, Examination of the heart is completely normal. And she said one of the these three episodes there is a jerky movement of one, but no in the post recovery any headache
yes,
or confusion or tongue bite or to match
yes.
more with epilepsy. So
Yes, doctor. What's your differential diagnosis for this case?
differential diagnosis first it is vasovagal attack possibly. This is one of them, the most probable diagnosis. But I wanted to do for this patient ECG also to rule out long
What?
QT.
No. Dr. Muhi, just answer the question. What's your differential diagnosis now?
You asked me and I tell you.
Yeah, other than the vasovagal,
I told you possibly heart problem because this is young age. So
which one?
wanted to
Which
do
heart
ECG.
problem?
I wanted to do ECG to rule out long QT syndrome for this
Uh,
patient or
Third
Burgade
differential
syndrome.
diagnosis for this case?
Third and least likely epilepsy, but against that, it is only few seconds and there is no post the attack recovery symptoms matching with epilepsy. But
Okay,
she said
fourth,
for me
fourth,
jerky movement.
fourth.
This is the only three. Again,
Okay, so,
it is
yeah.
يعني
How you investigate this case?
endocrine case, endocrine Addison or unlike this, but no evidence of Addison or any associated autoimmune disease. What?
Yeah,
Uh, I will do for here some blood test, CBC, and I will check for as an feel electrolyte disturb, see any changes in the electrolytes, potassium, sodium, magnesium, like this.
yeah.
Then I will do for here is a ECG to rule out any Burgada, any prolonged QT. Then I will do tilt table test for here. This is possibly also I will multidisciplinary team if any possibility still for epilepsy to do for her CT, brain, and EEG.
Yes, yes. How you are going to treat this patient?
Treatment is according to the results of
If
the
if if you if you consider this is a case vasovagal attack, how you are treating the patient?
This vasovagal attack is actually difficult to treat. Patient education, counseling, and I will ask the patient to increase water intake and to use stocks, high level stocks, pressure stocks to the. Uh, this is first, يعني first aid treatment of this case. But
Give me
vasovagal.
three give
Mm.
me three advice for the patient for vasovagal attack.
To drink
Mhm.
water more, to avoid dehydration, to take salts more, to use this pressure stocks. This is the
Okay.
best. And
Uh,
again, and يعني
yes.
avoid some some risks for heat trauma and like this.
Okay.
يعني
Okay.
just she feel anything, she sit down before if there is
Uh,
any
o-
or.
okay. Other than that, which medicine we want to give to the patient?
Yes, if this lifestyle fail, fludrocortisone we can give to increase salt and water retention for this and raise the blood pressure.
Okay, Dr. Muhi.
Mediodrome
Uh,
eye drops.
yes,
Mediodrome.
maybe. Okay. Do you want to refer this patient if still he's symptomatic? Do you want to refer anywhere?
I will form for her multidisciplinary team as I told you, including heart doctor and the neurology doctor.
Did you know any procedure for this refractory cases? What you will do for him?
Well, I sometimes for these refractory cases of vagal attack, they do cervical sympathectomy or stimulatory. Stimulatory is to the sympathetic tone, increase to sympathetic tone. Like this.
Okay, thank you, Dr. Muhi, for the doing the case. I don't know, Dr. Basim, you let me to comment first or you?
No, you're the
Yes,
one.
okay. Dr. Muhi, here we are learning from each other, and this is comment for me, yani for me first and for you, okay? To be honest, you're doing well, but here we'll blame you because you didn't tell the patient you have vasovagal attack. You mentioned the differential diagnosis first, but you didn't tell the patient you have vasovagal attack in
No,
spite
I
of that.
told the patient. I told the patient this is simple fainting.
No,
Simple.
you need, see, to be honest, examiner will not look, Dr. Basim yesterday or before yesterday, he talked about examiner. This examiner, not all will be nine. You need to tell the patient the right diagnosis. You have a vasovagal attack. This is a medical term for medical condition in which there is lab, lab, lab. Okay, you need to explain. Just see, this is not take this. My comment is all. Yeah, this is for you. Okay, this just take because we are learning from each other. Other than that, we need to complete the neurological history. Yani, this is a blackout, and this is a sudden loss of consciousness for a few seconds. You need to complete all CNS examination here. Don't don't leave the patient unless they complete the CNS examination. Then go for other systemic. You need to ask. Other than the CNS, the most important one is cardiovascular, and you need to exclude the symptoms of hypoglycemia. You ask me about excellent about symptoms of يعني did you check your blood sugar? Yes. Then you give me a lot of jargon. You ask about miscarriage. No need to tell miscarriage. Ask just about loss of pregnancy. I think other than that, I'm not remember. Uh, this is my comment.
What
You
is the
doing well. You doing well. But we need to ask briefly, and before, during, after, for any blackout, for any loss of consciousness, for any epilepsy attack. We need to ask before, during, after, and you need to we need to give the patient clear question. Yani, what was happen exactly? What do you doing? Movement, long standing, any pain, any emotion. We need to like this. Yani we need to give the patient some sentence. Yeah, not like what was happened exactly. Okay. Excellent. You ask about family history of sudden death. You ask me about this because we need to rule out here who come is the most important than long QT syndrome. Who come? Okay, I tell you, I have no chest pain. I give you just this is my uncle, like 65. This is not irrelevant. Okay, and the differential diagnosis for this case is vasovagal number one. Number two is epilepsy. Number three is cardiac syncope. This is a hookam. Number four is hypoglycemia. Again, is that blood sugar is normal. And by the way, vasovagal attack can cause limb jerking, but not tonic colonic jerking. Just can cause brief colonic jerking.
again,
Uh,
again this one, again this sentence?
vasovagal attack. Usually, okay, I will talk about vasovagal. Okay, vasovagal attack usually occur due to reflex bradycardia or peripheral vasodilatation. Usually triggered by emotion or pain. I tell you, I receive call from my family. I lost one of my relevant. This is emotion here, or pain, or standing for long time. This always the trigger factor for vasovagal. Okay, onset usually over the second, and usually preceded by symptoms like nausea, pallor. I tell you, I become pale, and even brief colonic jerking of the limb may occur. Okay, urinary incontinence is uncommon, and all symptoms of this is uncommon. Yani, salivation and biting of the tongue. These all are uncommon. Okay, the main differential diagnosis is epilepsy. Okay, and hypoglycemia and cardiac syncope. Yes, the diagnosis by Tilly table test. Okay, you will find bradycardia and hypotension sometimes. This is what we called bedside test. Also, we're doing blood sugar, LFT, and ECG and chest X-ray and echo. Even we will do blood sugar and blood pressure sitting and standing. You need to do. Other than that, yes, in examination, we need to examine the CNS first, this drifting sign. You didn't examine the patient drifting sign. Here, the most two system you want to examine cardiovascular and CNS. CNS just will examine the patient about the drifting sign, okay? You will assess if the patient drifting is okay, even no need to go for a tombo reflex. خلاص, patient
I, ch-
no.
I check the power in the upper limb and lower limb.
Yeah, but drifting is the most important than them. Drifting sign. Okay, you will ask the patient, please outstretch your hand and close your eyes. Uh, we need to check the blood sugar. Even blood sugar normal, we need to ask, we tell the examiner, yes, I want to check the blood sugar because hypoglycemia is differential diagnosis. Excellent, you ask about deriving and you stop the patient from deriving, safety netting, okay? I mean welfare. Vasovagal, you need to tell the patient you have condition called vasovagal. This is a medical term for medical condition in which there is your body overreact to some trigger leading to decrease the blood to the brain for few seconds and lead to symptoms that you have. Any chance of recurrent? Yes, you answer this. Yes, but we can give you some advice. What advice to give to the patient? Number one, avoid prolonged standing. If prolonged standing is difficult to avoid, we can do what we call counter pressure movement, like cross. Okay. Excellent. You said to me, increase your water intake. This hydration, good hydration, one of the advice, and avoid hot weather also, and increase your salt intake. Also, you said this. Medication, I will give fludrocortisone or midodrine. Both of them you said, and I will refer to cardiology. Sometime you can use beta blocker or dual even chronic dual chamber pacemaker. Even this is the refractory cases. This is all about vasovagal attack. I think she is appeared yesterday or today in India, in day two.
Thank you, Dr. Ahmed, for this case.
Yes.
Yeah, yeah. Okay, let Dr. Basim to comment.
Thank you, Dr. Ali. It's a common case and nice case as well. And Dr. Mohi should train on these scenarios, the blackout or syncope or fainting, dizziness, all under the same meaning. So you have to train how to do. And the cornerstone in this scenario, as Dr. Mohi did and Dr. Ali already explained, during and before and after, or before and during and after. You have to ask all questions. Don't forget the systemic review. Some patient will have chest pain or palpitation, awareness of heartbeat, so it would be cardiac. Or the others like checking blood sugar or losing the control over the water work, himself or herself. So all this question will guide you to the case. I believe this scenario, when Dr. Ali said I have lost one of my family member, it was the clue. So there is some stress, maybe effort, exercise, and doing a lot of works during the event occasion of sudden loss. I mean the family.
Long-standing fever. Long-standing also.
Yeah, could be long-standing. But I prefer to ask about stress as well. Do you notice this happen after stress?
Yes, yes, emotion. Yes, you are right, Dr. Basim. Yes,
Exactly.
that
Yes.
I tell him I receive call. This make me stress. Yes.
Yes. Plus, she told you I felt like pale, or someone told me you are pale. This is another clue. But
Yes, clue is okay.
exactly. As Dr. Ali said, please give the diagnosis. Tell her the name of the. You said yes, it's simple fainting. What the meaning of simple fainting? You know the diagnosis, but you didn't mention it. So vasovagal attack, one of the condition in which, as Dr. Ali said, the blood going to your brain is being less for a couple of minutes or seconds. Then you feel exactly what happened with you. Spontaneous recovery might happen whenever you are lying down or someone help you to sit or the emotion disappear. So this is the case. And I think Dr. Ali covered the whole topic from presentation, the systemic review questions related, and also the family history. Maybe there is family history of vasovagal, but sometimes it's not positive. So it's not necessary to be positive family history. The test, as Dr. Mahi mentioned, health table test, and it would be diagnostic. However, you have to do other tests like checking blood pressure, sitting and standing, blood sugar, ECG, echo, all tests to rule out other causes. EEG as well, you can consider as one of the investigation. I think the topic is clear. Anyone has comment or question about this topic? Vasovagal attack. Regarding driving, sometimes I will tell you the advice. Okay, you can tell him or tell her not to drive. Whenever she is diagnosed as vasovagal attack, she can drive back. Okay, so you are sure this is not cardiac because vasovagal usually happen when the patient is standing for a long time, dehydration, emotional stress. So you have to know what type of stress she have or what type of trigger she have. If just with standing, so she might driving it. However, let her inform DVLA, and the DVLA will update her about possibility for license resume. But you have
Yeah,
to
yeah.
advise her temporary. You have to stop driving. Yes, Dr. Ali, continue.
Yes, yes, you are right. But here in this case, because you are in exam setting and we need to test your knowledge about welfare of the patient, and I think it's better to advise to driving for a while and then
Exactly.
later to decide. Yeah.
Yeah, but I mean, sometimes this vasovagal attack comes as communication, so you have to
Yeah.
address the driving till when.
Yes.
But in this scenario, while she's still not yet diagnosed yet, you don't know what the diagnosis yet. You have to tell her, please stop driving for a while till we know the diagnosis and to confirm your disease.
Yes, you are right.
Okay. Any other question or comments? Dr. Ali, you want to add anything?
No, no, والله just yeah, here also Dr. Basim يعني the main focusing of this topic, examiner he want to يعني he want to test you, or the exam he want to test you. Did you ask about epilepsy, about all condition of epilepsy? Did you ask about all condition of the heart attack like this? يعني we need to rule out any epilepsy, we need to rule out any cardiac issue, we need to rule out any hypoglycemia. Okay.
Exactly,
يعني
yes. And you
yes,
can give them as differential for each other. Whenever you have
yes,
any fainting, you can say this is the vasovagal and can be epilepsy, can be hypoglycemia. According, and you can say against that the no heart beat awareness, for example, for cardiac cause, no loss of control, no biting of the tongue, no loss of consciousness for epilepsy as well. And last thing, vasovagal, as Dr. Ali said, it will be resumed after a couple of minutes or seconds if the
second.
patient, yeah, if the patient sit or lying flat.
Yeah, yeah, you're right.
Okay. Any question, Dr. Mahi?
No, yes, thank you, sir.
Okay, thank you, Dr. Ali, for the case, and Dr. Mahi for practice. Can you write the case for Dr. Ali?
Okay, sir.
I will read a comment quickly. Yeah, someone wrote the syncope differential diagnosis. Neurodiagnostic syncope, neurocardiogenic syncope, sorry, vasovagal, orthostatic syncope, neurological cause. Yes. Don't forget, if the patient is telling you, I have awareness of rapid or fast heartbeat, you have to consider what's called POTS syndrome. POTS, postural orthostatic tachycardia syndrome. The same presentation, patient will feel dizzy while standing from sitting, but instead of bradycardia, patient will have tachycardia. She will tell you, I have a feeling of fast heartbeats. Okay, Dr. Ali, your scenario, 27 years old male present with fever. Let's say John Adam.
Yeah, no problem. You can start, okay?
You can start? Okay,
Yeah,
let me set the timer.
change the timer, yes.
Okay, before moving, sorry, Dr. Ali. Dr. Sarah asked how to explain the vasovagal syncope again. Okay, vasovagal means triggered by standing for a long time or having any stress condition, emotional stress, even with cough. Some patient will have, with straining, for example, coughing, he will have the vasovagal attack in the form of decrease the blood going to the brain, and your blood will be, you will lose your awareness for a while. After that, if you lie flat or sit, you might regain your consciousness or awareness. This is the vasovagal attack.
Yeah. اللي هو overreact
Yeah,
of our body to some trigger factor, as you mentioned. This trigger, يعني you mentioned already, lead to decrease the blood supply to your brain for few seconds. Just same.
exactly. Yes. Okay, ready, Dr. Ali, to start?
Yeah, I think just share the time.
Okay, here you go.
يلا. Hello.
Hello.
Yes, I'm Dr. Ahmed, one of the doctors in the clinic today. I spoke to the Mr. Adam, 27 years old.
Yes, I am doctor.
Yeah, Mr. Adam, we are here to take history from you and address your concern is and examine you. Is that okay with you?
Yes, okay.
Yeah, it came to my knowledge you are suffering from the high body temperature. Can you tell me more about that?
Actually, doctor, over the 2 weeks back, I have this fever, recurrent fever, recurrent rise of body temperature.
Yes. It is this. Is this first time you have or before you have?
Yes, 2 weeks now, doctor.
Yeah. Since 2 weeks, it starts suddenly or gradually?
Suddenly,
Yeah. Okay. It is low grade or high grade?
I check it one time, it was 39.5.
Yeah, 39.5. Okay. Along with this high body temperature, do you have any history of sweating?
No,
Any history of rigors?
no,
I mean, shivering your body.
yes, no,
Yeah. Okay. Any history of recent traveling?
no,
Okay. Do you have any lumps or bumps in your body?
yes,
Yeah. Can I have a look?
yes. Where? Want to look where?
Yeah, this lump or bumps in your neck or where? Exactly.
In the neck, yes, in the neck and in the armpit.
Yeah, this is lymph node.
Yes.
Yeah. Okay. Apart from that, what about your weight? Do you have any weight change?
No, my weight is okay, normal.
Yeah. What about your appetite?
My appetite is normal.
Yeah, your appetite is normal.
Yes.
Yeah. Do you have any history of itching?
No.
Yeah. Okay. Do you have any history of throat pain?
Yes, I have throat pain.
Yeah. When did it start exactly?
1 month back.
Yeah, you have one month back. Okay. Apart from that, do you have any history of, I mean, any mouth soreness?
No, only throat.
Any, just only sore throat.
Yes, sore throat.
Yeah. Do you have any cough?
No cough.
Yeah. Do you have any chest pain?
No chest pain.
Any shortness of breath?
No shortness of breath.
Any awareness of heartbeats?
No.
Okay. Do you have any mouth soreness?
No.
Any tummy pain?
No.
Any tummy distension? No,
No.
tummy distension?
No. No.
Any change in your bowel motion?
No.
Do you have any bleeding from any orifice in your body?
No.
Yeah. I'm sorry for asking this question. Usually we need to ask this question to our patient. Do you have any sharing needle?
No.
Any history of blood transfusion?
No.
Uh, do you have any casual relationship?
No.
Any history of tattooing?
No.
Any history of piercing needle?
No.
Any contact with any sick patient?
No.
Do you have any past medical history that should be aware of?
I don't have any past medical history.
Okay. Do you have any history of joint pain?
Yes, I have joint pain in my
Where
hand
is it?
and my feet.
In both in your hand and your feet.
Yes. Yes.
When did joint pain start exactly?
1.5 months back.
Yeah, 1.5 months back. Okay, is this along with this joint pain? This any swelling?
Actually, no swelling.
Yeah.
But
Do you
stiffness.
have?
Stiffness. I have stiffness in my
Yes.
hand. Yes.
Is
In my
this
hand.
stiffness? Yes, stiffness at the morning
Yes, and some more.
for more than 1 hour or less than 1 hour?
I'm not sure, doctor, but it improve with movement.
Yeah, it is improved with movement and this pain at rest mainly.
Yes. Yes.
Do you have any skin rash on exposure to the sun?
Yes, I have rash.
Yeah, on exposure to the sun.
I have rash, but I am not sure it is related to sun or no. I will
Can
show
I
you.
have a look? Can I have a look?
Yes.
Okay. Do you have any history of falling hair?
This rash in the group now, okay? In the WhatsApp group.
I didn't notice.
In the WhatsApp group.
Yeah, this is where is this face or where is the side exactly?
This is the limb, upper limb. But
Yes.
yes, you are right. It comes in my limbs and in my trunk also.
Yeah, limb and trunk.
Yes.
Okay. Any history of falling hair?
No, no,
Okay. Do you have any weather preference?
no.
Okay. Apart from that, do you have any allergy to any medicine?
Yes, I have allergy to aspirin.
Okay. Since when?
This was when I was young. I take aspirin, and at that time, rash come to my skin.
Yeah. Did you? Okay. Apart from this allergy to aspirin, uh, can I know the list of medication you took?
I don't have any medication, doctor.
Yeah. What do you do for living?
I'm not working.
Are you smoking?
Yes, I smoke.
How many cigarettes for how long?
About 10 cigarettes per day for about 5 years now.
Yeah, 5 years now. Okay. Okay. Any history of blood clot before or recently?
No, no.
Okay. Mr. Ahmed, Mr. Adam, I advise you to stop smoking because it is bad for your health. If you need help, I will refer you to the smoking cessation clinic. What do you think about that?
Okay, doctor. Okay.
Do you drink alcohol?
Yes, I drink.
Okay. Did you feel pain when you after drinking alcohol on this lump and bumps?
No.
Okay.
Actually, doctor, I did not drink alcohol in the last 2 months. So I'm not sure if this pain increase or no, affect me or no.
Yeah. Apart from that, any family history of note?
Not for what?
Any family history of similar condition?
No, no. Yes,
Okay.
yes, yes, doctor, yes. My mom has also joint pain,
Yeah,
and
she has joint.
yes, and she was diagnosed, and she using methotrexate nowadays.
Yeah, she's on Mr. Said. Okay. Okay. Mr. Adam, if you don't mind, can I examine you?
Yes, examine.
Yeah. Firstly, I want to examine the hand and feet for any joint abnormality.
Yes, there is joint pain in the hands. He cannot move it properly, and
Yes.
you examine the patient. There is no stiffness at moment, but he told you there is stiffness yes before.
Yeah.
There is
Before
swelling.
the
There is swelling also in the joints, metacarbophalangeal joints.
yeah metacarpal pharyngeal joint there is swelling. What is this like? Swan neck or botanier deformity or Z
No,
deform or ulnar?
no, no deformity. No deformity.
Yeah. Yeah. What about the hand function?
Hand function is normal.
All hand function, prayer, reverse prayer sign.
Yes, yes, normal.
Okay. What about the hotness and temperature?
Hotness for hand?
Yes.
Yes, so there is hotness. Yes, okay.
Okay. Then I will examine the extensor for any nodule.
No nodules.
No nodules. Proximal myopathy.
No proximal myopathy.
What about the blood pressure of this patient?
Blood pressure normal.
Blood pressure normal. Okay. Then I will examine for face for pale jaundice.
No bile, no joints.
Then I will examine for the lymph node.
There is
All
lymph
lymph
nodes, yes. And there is cervical lymph nodes and there is axillary lymph nodes bilateral.
bilateral lymph node.
Mhm.
Okay. What about the BMI of this patient?
Body mass index
Yes,
23.
23. Okay. Then I will examine throat examination.
Nothing is there.
Nothing is there. Any skin rash or any skin face in, I mean rash in the face.
No rash.
Okay. Uh, no rash. Okay. Then I will examine the cardio for any uh, or the heart for chest auscultation for the chest and abdomen for any crepitation or any abnormal murmur.
No murmur, no gallop, no crackles, no wheeze.
Yes.
By
Then I
equal
will go. I will go
equal.
direct for. I will
Hmm.
go direct for the abdomen to examine for hepatosplenomegaly.
Yes, there is hepatomegaly and there is splenomegaly.
Yes. How much spleen below the costa? Okay. Both of them hepatosplenomegaly.
Yes, there is hepatosplenomegaly. You want how much size?
Yes.
Yeah, okay, 2 fingers below the costal margin and the spleen or 3 fingers below the costal margin.
Spleen the okay. Then I will examine the regarding the joint in the lower limb.
Yes, joints of the foot. There is swelling and tender also.
Yeah. Okay. I will see all this.
Hmm.
Uh, then lower limb edema.
No edema.
Okay. No edema. Then I will complete the question of this all patient. I will ask. And I will complete all of my question. Do you have? I don't know. I forget. Do you have any back pain?
No back pain.
Yeah. Any recent contact with the patient with tuberculosis? What we call tuberculosis?
You asked me this question before. No.
Okay. I don't know which question to ask. No, like swelling. No. No, no. Okay, I will check the temperature of this patient.
Temperature now 37.
Now 37, okay?
Yes.
Okay. May I know what's your concern?
What do I have, doctor?
Yes, Mrs. Adam, from what you said to me and after examining you, I'm thinking about you have infection. Don't bother by name. This is infection called infectious mononucleosis or glandular fever. Don't bother by name. This is a medical term for medical condition in which most likely may be related uh, this explaining all these symptoms you have. Uh, am I clear so far?
Okay, doctor. So there is treatment for this infection, doctor?
Yes, there is available treatment, but firstly we need to
2 minutes left.
run some blood investigation and even imaging, and we need to exclude other disease. Then we will give you treatment.
What disease, doctor, you wanted to exclude? So
Yes,
you will admit me?
your concern is valid, Miss Adam. As your condition is stable now and your blood pressure is stable, no need for admission. Just we'll run some blood investigation and we'll exclude other and we'll give you a painkiller and provide proper antibiotic for you for this infection.
Okay. So you will give me antibiotic now and I will go home now?
As I talked to you, Mr. Adam, I will do some blood
Okay.
investigation and scanning, I mean imaging. Then we will sit with you again.
Okay, doctor. Okay. Okay. Thank you,
You have
doctor.
any other concern?
No, thank you, doctor. Thank you.
Okay,
Yes.
still 1 minute more. You want to do any examination? You want to ask any question, or you want to go to the examiner, as you wish, Dr. Ali.
No. Here, just I will. Yes, I will go to the examiner.
Okay, let's start, Dr. Muhi. Examiner time.
Oh, you say, doctor, what is the positive finding in this boy?
Yes, 27 years old. He has complaining of fever and sore throat, along with that lymphadenopathy and generalized joint pain. I
Not
didn't
generalized,
appreciate
only in the hands and feet. Okay.
hand and feet. Yes,
Mm.
I didn't appreciate any abnormality or deformity in the joint.
Yes.
And on examination, he has hepatosplenomegaly along with a lymph node. Okay,
Yes.
my top of differential diagnosis for this is infectious. I think infectious mononucleosis
Do
or
you think
glandular fever.
infectious mononucleosis causing hepatosplenomegaly along with joint pain and swelling? Infectious
Allah, I will put.
mononucleosis causing
I
right?
will. I will put infectious mononucleosis. Also, I will put. You need to rule out infective endocarditis in this case. There is no. Also, I will rule out lymphoma. Okay, malignancy. I mean. Then I will rule out for this patient any infection. I don't know. I try to remember the infection can cause this, but I didn't remember all by now. But I will put infectious mononucleosis, okay, infective endocarditis and lymphoma, and even HIV. I will put in our differential diagnosis.
Sorry, doctor. Can you repeat again? What is your differential?
Glandular fever or infectious mononucleosis. Okay, infection. Number one, infection. Okay.
Infectious mononucleosis. What else? You
Number
said
two, I will put infective
uh,
endocarditis.
okay.
Then I will put also yes, I need to rule out connective tissue disease like SLE and rheumatoid arthritis.
Yes, like this. Yes, okay.
Yes, I will rule out because then I will rule out HIV also and lymphoma malignancy.
No, do you find any clue in the history possibility for HIV? No,
No,
no
but
sex, no
but
blood transfusion, no hospital
yes,
admission.
but even we need to rule out like this also.
So it will be routine now for any patient to test for HIV.
Yeah.
Okay, doctor. So you told the patient that you will admit for short few hours and you will do test, then give antibiotic and discharge. What is the test you wanted to do to
I didn't tell the patient you
for
need
this?
to admit. I will do some blood investigation, then we
Yes.
can sit with you. Okay. Firstly, in this patient, I will do complete blood count. I will do renal function test, liver function test. I will do inflammatory marker, ESR, and
Okay.
C-reactive protein. Also, I will do even I will do chest X-ray for this patient, and I will do blood
But
culture.
still, wait one by one. Now you did
Yes,
CBT, you find white blood cell count 22. Okay.
yes,
And you did liver function test, you find AST and the ALT threefold. Okay.
yes,
You did ASR C-reactive protein, you found ASR 88, C-reactive protein 25.
yes.
So any now you can this can narrow for you the differential diagnosis little bit.
He has leukocytosis and he has impaired liver function test.
Yes.
Okay. Also, ESR is normal, 25 just.
ESR 80, ESR 88, very high.
Yes, yes,
Okay.
ESR is yes, ESR is 88. Okay.
Mm.
Uh, what about platelet and hemoglobin?
Platelet high, yes, platelet is high.
Yes, and hemoglobin.
Hemoglobin normal.
Yeah, hemoglobin normal. Okay, then I will do blood culture. I will do lymph node, even I will do lymph node biopsy. I will see. Also, I will do blood
Infinite
film for
biopsy
this
in
patient.
ER. No patient in ER. You will do in ER. You only run some blood test now.
Yeah, it's why you are hurry to reach diagnosis now. Yani, this is an
I'm
investigation
not
and I will
hurry.
do.
I'm not hurry. But we wanted to reach the diagnosis with each other. We are thinking now.
Okay,
Okay.
I will do ultrasound, abdominal
If you
ultrasound to
will
rule
do
out.
if you will do lymph node biopsy, you will admit the patient for this yeah, because this is, you are not the one who will do the lymph node biopsy. You will
Is not
call another
mandatory. Is
doctor
not
to do it.
mandatory. Yes, is
And
not
and
mandatory to. Okay, and I will answer. Are you as you examiner, and I will answer. Okay, I will do abdominal ultrasound. I will do viral screening for this patient,
what you will
hepatitis
do,
B and
wait,
C.
wait. What is the benefit for every test you mention? Ultrasound now, you will see what? You will look for
I
what in ultrasound abdomen.
I will see the size of the liver. I will see if there is any
Already
stone.
increased, clinically sizable, big, megaly. There is megaly into in the two organs now.
Yeah.
Hmm.
Sorry, your question is not clear, Dr. Muhi.
You did ultrasound abdomen. You want now to do tests to narrow the differential diagnosis for you. Okay? So you did ultrasound. You what you wanted to look in ultrasound to narrow the diagnosis. Is there is any clue in the ultrasound to make this is infectious mononucleosis?
No, I will خلاص أنا will do viral screening or I will do
Yes,
rapid test.
okay. Do viral test, you will do HIV. Now it come negative. Okay, exclude it. صح?
I will do it hepatitis B and C also. I will do.
Yes, you do hepatitis C and B and also negative. Okay. What else?
Yes. Then I think I will do. I need to remember the test for. I will not remember, wallahi, to be honest.
Hmm.
For glandular fever, there is test. I think is monospot
Yes,
test.
yes, you are right now. So you
Yes.
do, I want you to tell me the test and what you found in the test, not only
No,
to enumerate the test
I'm,
itself.
I'm
Okay?
I'm not remember. To be honest, I'm not remember. But I think it's
What
monospot
you
test.
told, yes, serology for infectious mononucleosis. Okay.
Yes, yes. Monospot test. Yes.
Yes. So now you do also ferritin. You found the ferritin is very high, 1,000.
Yeah. This inflammatory. Yes. Ferritin and
Acute
ESR. Very high.
ferritin is one is inflammatory marker. Okay, like
Yes.
ESR. So it is high also like ESR.
Yeah. Here I will go. Yes. Yes. Okay. There is one he, and I don't like this, but there is one he helped me. He mentioned adult still disease.
مين الخطير ده؟
And I
Yes.
don't like this, wallahi. I don't like this in the group because here we need to give the candidate to be stressed. And I like this stress because in exam you are only one. No one will help you.
بس
And
خلاص الحالة، ما خلاص الحالة خلصت. هو يعني هو يعني صاحبنا ده قال لنا الكلام ده، ما فيش مشكلة.
but believe me, Dr. Mahi,
اوكي.
believe me, if you bring like this case, we will look for your differential diagnosis. And usually this case in exam will bring like what we called pyrexia of unknown origin. Will give you patient have fever more than 3 weeks. Okay, we
Okay,
need to, from you.
your differential diagnosis is right. You said lymphoma and is right.
Yes.
Connective tissue disease, systemic lupus and rheumatoid are okay. Infectious
Yeah,
mononucleosis or endocarditis, it is right. Your differential is right.
yeah,
And
yeah.
we are not attacking you. We only discuss with you.
No, but,
Well,
no, you
but,
know, yeah, this
but you
case is
know,
very good, wallahi, very good case. And I'm
yes.
happy for this case.
لما بجيب حالة فيها شغل يعني. دلوقتي infectious mononucleosis, it causes pain and stiffness in the similarly in the hands and the feet. Less likely. So
Less
also
likely.
infectious mononucleosis, it doesn't cause the salamon pink maculopapular
Rash.
rash that run
Salam,
in
yes,
the eye.
salam, Guldan.
And if you asked me about the fever, a fever, it is spikes only once a time per day, and it increase this fever increase with the rash. يعني rash and fever come with each other,
Yeah, yeah,
and
yeah.
rash become faint when the fever subside. And if fever subside either by paracetamol or alone. Okay. The
Yeah, yeah.
joint pain and stiffness with swelling, it occurs 1.5 months back. But the fever started earlier, يعني two weeks back only. Okay.
Yeah, yeah, yeah.
And lymph nodes and hepatosplenomegaly. So this all with each other, it go with adult onset still disease. Okay.
Yes, yes, thank you. Dr. Mahi, yes, I want to ask you. Thank you, Allah, very, to be honest, for me, very nice case. But Abir, before an exam,
والله ما اعرف. ما اعرفش اذا
yeah,
كان جات الامتحان قبل كده ولا لا.
yeah, before this exam, you need to, no, no, thank you. And for me, is very good. Wallahi, now I'm thinking um, I'm widening my thinking. For me, it's very good, even for all. But we need usually to practice the common case coming exam because this is will appear in exam. It's best. Thank you for sharing me this case.
Okay, thank you, Dr. Ali. Well done. Thank you, Dr. Mahi, for the case. You want to comment, Dr. Mahi, right? You didn't comment.
بس انا قلت هما الكلمتين اللي هم بتوع الادلت
Okay,
ان هو
yeah.
في سبايكس
No,
الفيفر.
comment, Dr. Basim, comment. We need your
Yes,
comment. It's very
comment is
important.
not common case, Dr. Ali. I didn't hear about it before in
Yeah.
cases, but once you practice it, you might have it in the exam and you will get the mark. So just learn from the lesson and the
Yeah.
session.
Okay.
As you said, we are learning. But
Yeah.
again, if you didn't reach the diagnosis, they will judge on your approach, your differential, your history taking. So we have to learn how to investigate and to take history about fever. I think you ask a lot of question which is related, and you roll out, and you roll in. Some of the condition might be the case. The screening for HIV is very important this scenario. I mean, the casual relationships, the risky habit. You have to ask all these questions. Contact with sick patient, call TB. Yes, all these questions make sense to roll out the common cases presented in bases. TB, for example, lymphadenitis, or HIV, lymphoma. I think this is the most common differential in this scenario. HIV, lymphoma, and TB. Plus, Epstein-Barr virus, as you mentioned. Cytomegalovirus also you can mention. And some viral infections, either hepatitis or cytomegalo I mentioned already. Dengue fever. It's like vague case. Malaria, if there is positive history of travel and you ask the travel history, which is also good in this scenario. For any travel, for any fever, you have to ask for travel. You have to ask about liver affection, jaundice, itching. You asked all these questions. The examination as well, you have to examine all lymph node groups all over the body, started from the cervical, the vercow, supraclavicular, axillary, even inguinal. You have to offer to do it. Offer it. If they accept, do it for the welfare. Okay, this is for the examination. But when he mentioned I have throat pain, I suspect the case is chronic fatigue syndrome. I don't know, is it possible to be because lymph node, joint pain, and also fever. I don't know. Is it possible, Dr. Mahi?
No, sir, sorry, because this long chronic fatigue syndrome is long history.
More than
Six
60
months,
months. Yes, you're right.
10 years. But
Yes,
this is
you're right.
only one month.
Acute.
Yes. Other than that, chronic fatigue syndrome, patient will come to you with يعني lymph node. He will tell you, yes, I have lymphadenopathy, but just will find tender, not a very large lymph node. And the
Either
main
both can be,
back
Dr.
pain.
Ali, really. It's possible to be tender or just lymph node without tenderness.
Mm.
It can
And
happen.
joint pain will be generalized, I think, in
Yeah,
chronic fatigue syndrome.
there is lymphadenopathy, there is joint pain, muscle pain, feeling fatigue, more than six, not interested to do any exercise, not interested even for daily activity, sleeping all the time, memory loss also, all this manifestation, but it's not the case. What about Felty syndrome, Dr. Muhi? I just wrote it also in the chat. There is
والله
splenomegaly, stiffness. Is it?
يعني هو يعني كان ديت على طول this is the second disease written after rheumatoid arthritis. Rheumatoid arthritis second is adult onset still disease because
Okay.
it gives a similar يعني
Yeah.
manifestation in the form of joint pain,
Mhm.
similar symmetrical in the hands with stiffness and but when
Splenomegaly
you
as
go
well.
more
Yeah.
deep, you found that hepatosplenomegaly, there is Salomon vein crash, there is lymph
Yeah.
nodes, not going more with uh, rheumatoid arthritis. So it was adult onset still. And this is يعني not a so rare disease.
Yeah. Yeah.
I
It
saw
happens.
I saw
Yes.
cases
Yes.
before, but
Yes.
I
Other
don't know.
than that, Felty syndrome usually patient will have neutropenia, not leukocytosis.
Yes. You're right. That's
Neutropenia, rheumatoid arthritis, and splenomegaly as consequence of rheumatoid arthritis. يعني you will find the
yes.
patient he has rheumatoid arthritis. This complication.
Or
Yeah. But
sometimes the Dr. Ali
yeah.
يعني patient has rheumatoid arthritis, but the extra-articular manifestations come earlier than the deformity of the hand. I read this in the book. Yeah. Extra-articular manifestations in the form of splenomegaly and neutropenia like this can be arise and more clear than the deformity of the hand. The deformity of the hand will occur later, yeah.
Yeah, usually appear late. You are right.
Perfect. So it's a brainstorming case, although it's rare, but we learn it.
Yeah,
Yes.
والله we learn. Right, Dr.
Yeah.
Basim. Second
Yeah.
thing, this is a big journey, big journey. And this is case if came in exam, big journey.
Mm-hmm.
يعني we need to ask all, but same, I think same task. يعني we need to ask same question and same sequence. And we need to put differential diagnosis. Am I right?
Yes, of course. Infectious disease, you have to ask most of the common, as I mentioned, and to roll out everyone by question. For example, HIV, tattooing, sharing needles, all these questions should be asked. This is
Dr.
regard.
Salma told us before
Okay,
they want from you structure, history, and
exactly.
examination.
Yeah.
And if you don't reach the diagnosis, this is not big issue. You only, well, Allah, I was very happy when Dr. Ali asked me early, did you have travel recently? Because
Yes.
fever is, so you should go
Yes.
structure in the history and examine and rule out. They want this structure and يعني step by step go. Otherwise,
Exactly.
you reach the diagnosis or no. So no problem, yeah.
You can add to the question any stiffness, as Dr. I think Dr. Ali asked this question. Any back pain also related to the musculoskeletal, could be as discitis as a cause. Anyway, it's a nice case. Thank you, Dr. Mahi. Thank you, Dr.
It
Ali. Any
come to
question?
this case
Yeah.
Yeah,
come
والله,
to our
والله thank you,
we
Dr.
have one
Basim.
patient.
Just I want to say one sentence after complete, Dr. Mahi, sorry.
Okay,
Mhm.
no problem. Okay. We have one patient like this came to our CCU in cardiology unit, and this patient admitted with us about chest pain or anything like this. And second day and third day, we found this cerebral being crash and joint pain. So we consulted the rheumatology, and this was very clever doctor. Really, she came and she diagnosed this patient adult onset still disease, and she started non-student inflammatory, no response with a small dose corticosteroid, no response. The second day she came and gave patient methotrexate, and the patient completely recover and they become يعني
والله.
appear fever race appear like this.
What do you mean,
And
Dr. Mahdi? You mean the woman more smart than men?
No.
this,
You are right. You know, Dr. Basim, this
Yes.
is the real. This is
Yes,
the
I
real.
know.
The
I
most,
agree with
the
Dr.
most.
Mahi.
I will give you this. This is from our professor. The most knowledgeable physician, rheumatologist, and the
Yeah.
most least knowledge physician, cardiologist.
تغلط فينا
Mm.
كده ليه بقى حد زعلك؟
No. Because cardiologist we have two, echo and ECG and just PCI.
لا لا
This
لا
is not against you.
لا لا
والله
ده
this is
ده
right.
معلش سامحني انت غلطان والله ده احنا عندنا معلومات جامده خالص
خلاص
بجد
العيان جاء.
والله.
Now patient he increased by rheumatology, not by you.
Okay. Thank you, Dr. Mahi.
Uh, just and I will say, Dr. Basim,
Yeah,
lastly,
sure.
fever, basis wise, usually come by infective endocarditis, come by
Yes. Yes.
SLE or rheumatoid arthritis, came by malignancy. As the commonest one is lymphoma. This is fever and brucellosis, by the way. Okay,
Yes.
this fever, يعني fever basis wise, usually. Sometime came with a CNS infection like meningitis, and this is acute.
Yes.
يا ريت والله يا دكتور علي الواحد يفكر زيك كده انه الحالات اللي بتيجي في الامتحان بس وخلاص
Because
فاهم.
I have trial in exam. That's why I tell you.
مم.
Dr.
Yes.
Mahi, you have to do the common when you satisfied with your performance on the common cases. Now you can think about the less common case, but you have to do the common case initially.
Yeah,
Okay?
wallahi, you are right,
Yes.
Dr. Basim. You are right.
Exactly.
We need to practice the common cases came in exam. And
Yes,
because
exactly.
if you, I have no doubt to do like this, and even this, wallahi, all now benefit and all happy. But if you doing the common cases, common is common. Rheumatoid arthritis,
Exactly.
SLE, infective
Yes.
endocarditis, common is common. Even listen to any monitor, he will tell you common is common.
Yes, exactly. You have to start with the common cases. Yes.
Yes, thank you, Dr. Basim, for
Most
giving us the
welcome.
chance.
No,
Okay.
no. Thank you, Dr. Ali and Dr. Mahi. Most welcome. Okay. Let's open the discussion now. Any suggestion? Any comment? Dr. Aisha, you want to do any comment? You want to add any suggestion? Okay. Dr. Muhammad Omar wrote, yes, his approach was excellent. Yes, I agree. Dr. Sarah, I think saying yes for my comment about woman or clever doctor or woman. Okay, Dr. Aisha, no, nothing. Thank you all. Thank you, Dr. Aisha, as well. Differential breeze for the case. Dr. Sarah is asking about the differential, Dr. Mahil. So, adult onset still disease. And what the next?
lymphoma,
Lymphoma. And
connective tissue disease, systemic lupus, rheumatoid arthritis.
okay, and that's enough.
Yeah, number one, you need to say
And
infection. Just number one
endocarditis,
is mandatory to say
endocarditis,
infection.
Oh,
endocarditis, another differential diagnosis.
okay. Any other comment for glandular fever? Yes, someone wrote peripheral smear. Yes, with serology for antibodies. Any viral serology you want to do, say PCR or serology, and you can add antibodies for particular or specific or some viruses, like ELISA for HIV. Monospot test, yes, not recommended now, maybe before. Thank you, Dr. Ihda, for glandular fever, yes. You did very well, Dr. Ali, by Dr. Muhammad. Adult onset still disease. Give us summary to the case. It was a case of lymphadenopathy with the joint pains, with skin rash, and There was also history of stiffness in the joints with no travel history, fever for acute onset. This is the summary of the case. Adult onset still disease, yes, I agree, Dr. Muhammad Hussein. Good, Dr. Ahmed, share lymphadenopathy differential. Please, you can share this photo to the group to be more useful and beneficial, please. Okay. I think all comments has been read. Any other comment, suggestion? Satisfied all? Okay. If no more question, we can end the session. See you tomorrow with Communication Day. Thank you, Dr. Ali, Dr. Mahi again, everyone. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.